Aniball je zdravotnický prostředek.
Aniball is a medical device intended for prenatal preparation, prevention of perineal injuries, and stress urinary incontinence.
Silikonový nafukovací
It is an inflatable silicone balloon that helps women explore their pelvic floor and understand that this part of their body can be consciously controlled. It is closely connected to breathing and works just like a diaphragm. It relaxes during inhalation and activates, contracts, during exhalation. Women who use Aniball before giving birth become familiar with the feeling of pressure caused by the baby's head in the birth canal. The Aniball balloon helps women learn to respond to this pressure and consciously relax with the help of correct breathing and a suitably chosen position. Aniball should also be used after childbirth and postpartum period to restore normal function of the pelvic floor muscles and prevent stressed urinary incontinence. Aniball is not a dilation device. The aim of the preparation is not stretching the birth canal and perineum. Focusing on the achieved size of the balloon and trying to increase the size at all costs is not the main aim either. The main purpose of use is to practice conscious relaxation of the pelvic floor muscles through correct breathing and intuitively chosen position without forced pushing, which often leads to injuries of the pelvic floor and lack of oxygen for the baby. Yes, it is true that our mothers and grandmothers did not use such devices and also gave birth. But as we know, they mostly gave birth at a much younger age, didn't have a sedentary lifestyle, didn't deal with so much stress and diseases of affluence, or didn't use hormonal contraceptives from an early age. These are all factors that affect the function of the pelvic floor and can significantly complicate childbirth and the ability to relax during it. We know that in order to release the hormones necessary for a smooth childbirth, we need to feel calm, safe and warm. We need to be able to disconnect from the more complex part of our brain called the neocortex, which is responsible for our rational behavior. We should listen to our inner voice when giving birth, regardless of what's going on around us. We should listen solely to our intuition, choose an intuitive position, and push only when we feel the urge to push, not in a controlled way, on command and under stress. As you know, the delivery room might be noisy or cold. There might be many people. We should not be deprived of the feeling of intimacy, as it might lead to the exactly opposite reaction, to stress. In that case, adrenaline is released, and that causes tightening of the muscles and hinders a smooth labor.